Hello everyone, hope you're all doing good. In this video, we are going to discuss about some of the important symptoms and signs of pregnancy. Now we'll see trimester wise. Okay, so in the first trimester, what is the most important symptom that the patient will present with? When she will be suspicious of pregnancy? Yes, it is amenorrhea. Okay. Okay, so amenorrhea gives a suspiciousness of pregnancy. Remember, amenorrhea is not a confirmatory sign or symptom. Okay, but it is the most important cause of secondary amenorrhea in females. Okay, especially in the reproductive age group. Okay, so whenever a woman presents with secondary amenorrhea, you have to rule out pregnancy. Okay, so when there is missed cycles in the reproductive age groups, you have to rule out pregnancy by doing either biochemical tests or an ultrasonogram, right? And another important presentation can be bleeding. Now you may ask me, ma'am, just now you told that amenorrhea is a symptom of pregnancy, then how come bleeding will also happen? Yes, it will happen. How? Yes, it is about the implantation bleeding. Yes, very good. Okay, so we are talking about the implantation bleeding, or it is also known as placental sign. Okay, it is the implantation bleeding or the placental sign, and remember, this happens 7 to 8 days after fertilization, right? Now sometimes this can be mistaken for normal menses. Okay, now we'll see some important causes of early pregnancy bleeding, which are going to be the differential diagnosis of this implantation bleeding. Okay, so early pregnancy bleeding causes, okay, may include number 1, implantation bleeding, okay, or it can be a sign of ectopic pregnancy, okay, or abortions or miscarriages, then molar pregnancy. Then also try to rule out some of the local causes. Okay, local causes means in the cervix it can occur due to any infections that will be causing cervicitis or polyp. Okay, or there can be any trauma or tumor, and also in the vagina there can be vaginitis. Okay, and also in the uterus also. Okay, rule out polyp in the uterus and even fibroid. Okay, so these are some early pregnancy bleeding causes that are going to be the differential diagnosis of implantation bleeding, right? Okay. Next is about nausea and vomiting. We all know this is the most common symptom patients will experience, right? And this can be seen in 50 to 90% of pregnant women. So it generally starts around 5 to 6 weeks, okay, peaks around 10 weeks, and after 16 weeks it is going to resolve. Okay, so this is how it is going to be. Okay, and in some cases Okay, when it is excessive, vomiting in pregnancy is excessive and it is associated with more than 5% weight loss, say more than 3 kilogram of weight loss, or it is associated with any electrolyte disturbances or ketonuria. Okay, then it is called as, yes, it is called as hyperemesis gravidarum. Okay, so what is the most common cause of this nausea, vomiting, hyperemesis and all? Yes, it is hCG hormone and even the estrogen and progesterone hormones. In estrogen, especially the estriol hormone. Understood? Okay. Now, another one point. So, what is the scoring system we use for hyperemesis gravidarum? It is the Puke scoring system. Clear? Right. Now, some other symptoms like she may also experience fatigue and general malaise. Okay, so this can usually start in the first month itself. Okay, and it is mostly due to progesterone hormone because it can bring some sleep inducing nature. Okay, so it has some sleep inducing properties, so that is going to cause this fatigue and malaise. And then we'll see the breast changes. We'll see the breast changes. So breast is going for enlargement. Okay, and there is even tenderness in the breast. Okay, so while talking about enlargement, there are two things happening. Okay, one is ductular proliferation and another one is alveolar proliferation. Okay, remember the ductular proliferation is due to the hormone estrogen. Okay, whereas alveolar proliferation is also due to the hormone estrogen, but more of progesterone action is seen here. So it is progesterone more than estrogen. Okay, so don't get confused with this. It is D for E. Okay, and A means it is PE. So it is DE and A, right? And what will be happening is there will be pigmentation and enlargement of the areola also, and hypertrophied sebaceous glands. What are they called as? Yes, it is the Montgomery tubercles. Okay, it is Montgomery's tubercles. They will appear on the areola. Okay, so there is raised Montgomery tubercles like this. Okay, so whatever you see here. Okay, and there is further pigmentation. You see the color difference here, right, of the areola. Okay, and another important symptom she can present with is there can be increased frequency of micturition. Okay, and this increased frequency of micturition is due to pressure on the bladder by the enlarging uterus. Okay, and it will increase when the uterus is becoming a abdominal organ from a pelvic organ. Okay, so it will happen mostly around the 4th month. Okay, say 12 weeks. Yes? Okay. Now, we will see some important signs. Okay. First you have to know that the uterus is a pear-shaped organ normally. Okay. Then it will become a globular shaped organ. Then it will become a spherical shaped organ. Then finally it will become a ovoid organ by term. Okay. And what happens is the uterus as well as cervix are going to become softer. Okay. Now, as I told you, by 12 weeks of gestational age, that is by the 4th month, you will be able to palpate the uterus as an abdominal organ. Okay. Now, we will see some important signs. Okay. Number 1 is Hegar's sign. Hegar's sign is seen around 6 weeks of gestational age. Okay. There is softening of the lower uterine segment. Okay. So, if you do a bimanual palpation means palpating the uterus from both the sides. Okay. So, you will be doing a pervaginal examination as well as a per-abdominal examination. Okay. So, bimanual palpation, what is going to happen is the uterus walls are thinned, uterine walls are thinned out, and the fingers of the abdominal and the vaginal hand can be approximated. Okay. So, this is Hegar's sign. Okay. Now, I hope in this picture you are able to see Hegar's sign. Okay. So, we are doing a pervaginal examination and a per-abdominal examination, and we are able to approximate our fingers over here because there is a softening. Okay. And this is a pregnant uterus. Okay. Next, we will see about Jacquemus sign or Chadwick sign. Okay. So, in this sign, you will be able to see a bluish tinge of the cervix and even the vaginal mucosa because of increased vascularity. Okay, and this can be appreciated by a perispeculum examination. So, this is a perispeculum examination. Okay, so in this perispeculum examination, you are able to see a bluish tinge over here. So, this is a pregnant cervix, whereas here you are having a pink color only. That means it is a normal state. Yes, and remember, this is seen mostly during 8 weeks of gestational age. Okay. Next sign is Osiander's sign. Okay, here you will be able to feel the pulsations through the fornices. Okay, and this can be appreciated by 8 weeks. Okay. Next sign is Pisca's sign. Okay, here there is asymmetrical enlargement of the uterus because of lateral implantation. Okay, so one half of the uterus is firm than the other half. Okay, so if you see in this picture, you are able to identify this zone of softening. Okay, so this is the zone of softening. So, zone of softening is there because of lateral implantation. So, this is known as Pisca's sign. Okay. And then we also have the Palmer sign, where there is regular and rhythmic contraction of the uterus, okay, that can be elicited by manual examination, okay, and this can be seen around 4 to 8 weeks of gestational age, okay. Next sign is Ladden sign, okay, where there is a zone of softening at the region of isthmus, okay. So, this is a uterine picture where you have the fundus, okay. So, this is the body, this is the cervix. So, the junction between the body and the cervix, okay, so this region, okay, is known as isthmus. If there is a site of softening at the region of isthmus, okay, then it is known as Ladden's sign, okay, and this sign is usually seen around 6 weeks of gestational age. Yes? Okay. And in some cases, there can be softening at the fundus also, okay. So, here also there can be a softening, that is also known as von Braun Fernwald sign, okay, and this can be appreciated around 5 to 8 weeks of gestational age. Clear? Yes? Okay. So, we will summarize all the signs now. Number 1, we saw about Hegar sign, okay. So, that is, you will be able to bimanually approximate both abdominal and vaginal fingers, and this can be seen around some 6 to 10 weeks, okay. And next sign is, you have the Jacquemus or Chadwick sign, and this is approximately seen at 8 weeks of gestational age. Next sign is Osianders sign, okay. Osianders is easy, okay. So, you put 2 round, okay. So, that is 8 weeks of gestational age, okay. And next is Goodell sign, okay, which is softening of the cervix. This is seen around, 6 weeks of gestational age. And next sign we have seen is Palmer's sign. So, there is rhythmic and regular uterine contractions, and this can be seen around 4 to 8 weeks of gestational age. And next is, we can hear, repeat. Next is, you can have von Braun Fernwald sign, where there is softening of the fundus, okay, and this is seen around 5 to 8 weeks of gestational age. And there can be Ladden sign also, whereas there is softening of the isthmus, and this is usually seen around 6 weeks of gestational age, okay. Also, we have seen about the placental sign, that will be around 7 to 8 days after fertilization. And one more sign I want to add, that is McDonald's sign, okay. So, in McDonald's sign, there is a easy flexibility of the uterus, okay, of the uterus over the cervix. Clear? Yes. And also, you will be able to hear fetal heart tones, okay, and this can be heard using handheld Doppler devices around 11 to 12 weeks of gestational age. Clear? At this point, I just want you to discuss about fetal cephal and uterine cephal also. Now, fetal cephal is a sharp whistling sound. Uterine cephal is a soft blowing murmur. Okay. So, what are the fetal arteries will be able to palpate outside? It is the umbilical arteries. So, it is caused by the blood flow through the umbilical arteries. Okay. So, blood flow through the umbilical arteries. Whereas in uterine cephal, yes, as the name suggests, it is caused due to the passage of blood to the uterine vessels. Okay. And fetal cephal will be synchronous with the with the fetal pulse. Okay. Fetal cephal is synchronous with the fetal pulse. And if you take uterine cephal, it is synchronous with the uterine pulse. Okay. And remember, uterine cephal is not a diagnostic thing of pregnancy. Okay. Because when pregnancy occurs, definitely there should be a fetus, right? So, only fetal cephal is a diagnostic of pregnancy, whereas uterine cephal is not diagnostic of pregnancy. So, any other condition in which the uterine vasculature increases, for example, a fibroid uterus, in that you can hear uterine cephal. Clear? So, this is the uterine cephal because there is dilated uterine arteries through which the blood flow is increasingly flowing. Okay, so you will be able to hear a soft blowing sound through the uterus, right? Now, we will see about the signs. Uterine enlargement. So, we know around 12 weeks, the uterus comes just above the pubic symphysis. Okay. Then, by 16 weeks, it is at 1/3 distance between the umbilicus and pubic symphysis. Okay. And by 20 weeks, it is at the umbilicus lower border. And regarding the changes in the breast, okay, the colostrum secretion can happen during this period. Actually, it can start anytime between 12 to 16 weeks. So, colostrum can be expressed from the breast. Okay. Now, we will see about skin changes. We can have linear nigra that can happen due to estrogen, progesterone or melanocyte stimulation. And there can also be melasma, which is pigmentation over the cheeks usually. There can be central pigmentation in the face or even mandibular pigmentation also. Okay. Then there is an increased pigmentation of skin over the breast, okay, nipples, areola, and even over the vulva, perineum, axillae and umbilicus. Okay. Now, one important skin change is stria gravidarum. Stria gravidarum occurs due to breakage or breaking up of collagen. Okay. And the next one is spider angioma or spider nevi. Okay. So, this happens due to increased level of estrogen hormones. Okay. It consists of a central arteriole and radiating thin walled blood vessels. Okay. It just looks like a spider's web. Okay. So, that is why it is called a spider angioma. And next one is palmar erythema. Okay. So, this is also due to again increased level of estrogen. Now, these are the skin changes we have discussed. Okay. So, we will see one by one. So, this is the linea nigra. Okay. So, linea nigra. Linea means line. Okay. A line like pigmentation. Okay. That is seen in the center. Okay. So, this is your melasma. Okay. And this is your spider angioma. Okay, you have a central arteriole over here and that is having radiating blood vessels. Okay, and this is stria gravidarum. Okay, and this is palmar erythema. Clear? Okay. Now remember, by 18 to 20 weeks, okay, if you take between 18 to 20 weeks, fetal parts can be palpated. Okay, and this can be appreciated by either an external ballottement or internal ballottement. Okay, now first we will see the external ballottement. In external ballotment, we are going to ask the woman to lie in dorsal position and will be placing the hands on either side of the uterus. Okay. Then we are going to do tapping from one end so that the fetus bounce backs on the other end. Okay. Because in this stage there is more amniotic fluid and this amniotic fluid helps in movement of fetus from one side to another. Can you understand? Okay, I will tell you. See, this is external ballotment. Okay, so what I am going to do is, I am asking the mother to lie in the dorsal position. Okay, imagine there is a pregnant mother here. Okay, now what I am going to do is, I am going to keep my hands like this. Okay, I am going to keep my hands like this on either side of her uterus. Now, I am going to give a gentle tap, okay, from this side. Now, this tapping, okay, will move the fetus from this end to this end because there is more of amniotic fluid. Okay, so fetus will be easily movable within the amniotic fluid. Just imagine. Okay, just imagine. So, what is going to happen is, I will be feeling the fetus over the left hand. Okay, the fetus will be just coming and tapping over my left hand. So, this is external ballotment. So, for better understanding, if you see the pic, you will be able to understand. So, what I am going to do is, I am going to the hands are placed on either side of the uterus. You are going to displace the fetus by this hand and the impulse is felt on the opposite hand. Simple, right? So, this is external ballotment. And next one, we can even perform a vaginal examination. and in this stage will be confirming the internal ballottement status of the fetus. Okay. So, this is elicited between 16 to 28 weeks of gestation. Okay. And before this or after this, it is not possible, because before this there are extreme sizes of the fetus. Okay, here the fetus is much big and here the fetus is very small to elicit the speeches. Okay, so this is external ballotment. What we are going to do is, we are going to do per vaginal examination, and with a single finger, okay, with a single finger I am going to tap the cervix from downwards. Okay, and what I will be able to do is, okay, what I will be able to feel is, the fetus goes, hits the uterine fundus, and it will come back again, and it will again hit the same finger. Okay, just a tap like this. Imagine this is the baby. Just a tap like this, the baby is going upwards, and again it hits the uterus and coming back again to hit the same finger again. So this is internal ballottement, and remember, internal ballotment is done around 16 to 28 weeks of gestational age, right? And during this period, you will be able to see other findings in the vagina and cervix, that is bluish discoloration of the vagina and the cervix can also be seen. Okay. Next is, we will see about third trimester. We will see the symptoms first. Okay. So, there is an enlarging uterus, okay, that is causing much distension. There is enlarging uterus causing abdominal distension. Okay. And because of this abdominal distension, the position of the diaphragm changes. Okay. So, it is pushed upward, right. So, it is pushed upward. Okay. And this can lead to breathlessness. It can lead to breathlessness. Okay. And palpitations can also occur because of some changes in the cardiovascular system. Okay. Now, at near the term, you will be able to see one sign called as lightning sign or welcome sign. Okay. Now, this happens when the fetal head enters the pelvis. Okay. So, the fetal head is now going to enter the pelvis. Okay. So, because of this, what is going to happen? There is reduction of the gravity uterus. The pressure given by the gravity uterus on the diaphragm is going to get reduced, so that the breathing becomes more comfortable, right. So, this is known as lightning sign or a welcome sign. Then, if we see some signs, okay, I want you to make clear some points before we see the exact thing. So, it is, remember, here the fetal movements are easily felt. Okay. The flanks are full after 38 weeks, and at the same time there will be uterine fall forward and shelving occurs. What does mean by shelving means? The uterus falls forward and there will be a space that is created on the uterine fundus. Okay. So, it means it will be acting like a shelf. Even you can keep a book over the uterine fundus as it falls forward. Okay. So, that is called as shelving. Okay. Now, we will see how perabdominally we will be able to palpate the uterus according to various gestational ages. Okay. So, we have already seen around 12 weeks the uterus is just palpable above the pubic symphysis. Okay. Then 16 weeks it is palpable 1/3 of distance between the pubic symphysis and the umbilicus. Okay. Next is around 20 weeks, say it is palpable at the lower border of umbilicus. Okay. Next is around 22 weeks. Next is around 24 weeks, it is palpable around the upper border of umbilicus. And around 28 weeks, 32 weeks and 36 weeks. Okay. How I will be dividing means, I will be dividing the upper half of the abdomen into 3 quadrants. Okay. So, it is measured as 1/3 distance from umbilicus and xiphisternum. Okay. And 32 weeks level is seen at 2/3 distance between the umbilicus and xiphisternum. And 36 weeks means it is exactly seen at xiphisternum. And what is going to happen around 40 weeks? The fetal head is going to descend or it is going to engage, right? Engage means it is going to pass into the pelvis. So, at the time what is going to happen? Again, the fundal height will come down. Okay, so it will come down to 32 weeks again. Okay, so it will be palpated at the level of 32 weeks. And what is the difference between this 32 weeks and 40 weeks? Then means how you will be able to differentiate here means by 32 weeks the flanks are not full. Okay, flanks are not full. Whereas by 40 weeks, if you see the flanks are full. Clear? Now, we are going to draw a diagram by ourselves. Okay, so you can understand it better. Okay, so if you see, let us take this as the maternal abdomen. Our important landmarks are xiphisternum, okay, the pubic symphysis, okay, this is the pubic symphysis, and we also have the umbilicus. Okay. Now, the uterus is just palpable. Okay, it is just palpable around 12 weeks of gestational age. Okay, and by 16 weeks, this is 1/3 of the distance between the pubic symphysis and the umbilicus. Okay, and by 20 weeks, it is at the lower border of the umbilicus, and by 24 weeks, it is at the upper border of the umbilicus. Okay, and from here, okay, from the upper border of the umbilicus to the xiphisternum, we are going to divide it into 3 equal parts. Say part 1 and part 2, and this is part 3. Okay, now this region corresponds to 28 weeks. Okay, this region corresponds to 32 weeks and this region corresponds to 36 weeks. What is going to happen during term? The fetal head is going to engage so that the uterine height is going to come down, and at 40 weeks also you will be able to palpate the fundal height at 32 weeks only. The only difference going to be here is at 32 weeks the flanks are not full. Okay, flanks not full, whereas at 40 weeks the flanks are full. Okay, so this is what you have to understand, right? Okay, I hope I made it clear. Okay, now we'll see about fetal heart sounds. Okay, in later gestations. Okay, now in later gestations, fetal heart sounds are usually heard over the lower pole of the uterus. okay, mostly on the side of fetal spine, okay, that is where the back is there, okay, where the fetal back is there, there only you will be able to hear this sound, and it is not audible in, okay, it is not audible in cases like obesity, or if there is a polyhydramnios, okay, or occipito-posterior position, or if there is a intrauterine death. Okay, in these cases fetal sounds are not audible. Okay. Now we will pass on to the differential diagnosis of pregnancy. Differential diagnosis of pregnancy include uterine fibroid, cystic ovarian tumor, encysted peritonitis, distended bladder, and pseudocysis. Okay. Now we will see about the fibroid. See, generally fibroid is a slow growing tumor, okay, and the differentiating feature is amenorrhea is absent in fibroid. Either they can go for abnormal uterine bleeding, okay, or dysmenorrhea, but there is no amenorrhea. Amenorrhea is absent, okay, and also the signs and symptoms of pregnancy what we have discussed so far is absent. And one more thing is fibroid will be firm in consistency, okay, while palpating. And the next differential diagnosis is cystic ovarian tumor. Cystic ovarian tumor is also a slow growing tumor, okay. Similarly, here also amenorrhea is absent, signs and symptoms of pregnancy is absent, okay, and here the fetal heart sounds, okay, including the fetal heart sounds, these are absent. And next one is encysted peritonitis, okay. If you see, these patients will be having a history of tuberculosis, okay, and these patients may even have a history of amenorrhea for longer duration, okay, but the swelling will be as such a ill-defined swelling, and normal uterus can be separately felt, okay. Normal uterus is usually separated from the swelling, okay, and if you do a USG, you can see there is no fetus. Clear? Next is about bladder, okay. Sometimes pseudocysis is a false, spurious, phantom pregnancy, okay. There is no pregnancy at all, okay. So, this is actually a psychological disorder, and the woman firmly believes that she is pregnant, okay. Most of the times she will be an infertile woman who has an increased desire to get pregnant, okay. That will be the problem that will be leading to the psychological disorder, and sometimes there can be amenorrhea also, okay, and gradual enlargement of the abdomen also. How? Because of deposition of fat. Okay, not due to pregnancy, it is due to deposition of fat, the abdomen enlarges. And sometimes the woman perceives the intestinal movements, right? So, what she will think is, these intestinal movements will be imagined as her fetal movements. Okay, in serious cases, even there can be a spurious labor, that is a false labor that will set in. Clear? So, ruling out is very easy. All pregnancy tests and examination, okay, are going to be negative. Clear? Right. Now, I am going to divide all the signs of pregnancy into positive signs, presumptive signs and symptoms, as well as probable signs and symptoms. Okay. So, the only confirmatory signs of pregnancy will fall under this positive signs. Okay. So, number one is, so we will see one by one, positive signs. Okay. Number one is palpation of fetal parts and perception of the active fetal movements, not by the mother but by the examiner. Okay. And this can be felt around 20 weeks of gestational age. Okay. And there can be auscultation of the fetal heart sounds and ultrasound evidence. Okay. As early as 6th week also we can get ultrasound evidence of pregnancy, and even at 16th week, okay, it can be further confirmed by seeing the fetal skeleton, okay, and other scan reports. Okay. Now, what are the presumptive signs? Okay. So, these include, that is appreciation of fetal movements by the mother. Okay. And other symptoms may include amenorrhea, increased frequency of micturition, and whatever we have seen, that is morning sickness, nausea, okay, fatigue, okay, breast changes, skin changes. Okay. Next we will see the probable signs. Okay. Probable signs include abdominal enlargement, okay, Braxton Hicks contractions, external and internal ballottement. Then all the signs what we have seen, that is, for example, Osiander sign or a Chadwick sign. Okay. Then change in the uterus. Okay. The size, shape, consistency, everything is going to change. Okay. So, these are the probable signs of pregnancy. Now, as a final touch, I want you to know about the signs of previous childbirth. Okay. Also. Now, how we can find that she had a prior delivery. Okay. So, number 1, the breasts become flabby. Okay. Nipples are prominent. Okay. In women who have breastfed their baby. Okay. And alveolar pigmentation. Okay. Alveolar pigmentation is high. Okay. And if you see the abdominal wall is more lax and loose. Okay. There can be linea alba. Okay. The linea nigra just turns into linea alba, as well as the same way the stria gravidarum changes into stria albicans. Okay. Now, the uterine wall also becomes less rigid. Okay. And it will be more broad and ovoid. Okay. And when she had a normal delivery, you will be able to see the perineum also to be relaxed. Okay. And there can be scar of the episiotomy or perineal laceration. Okay. Sometimes you will also be able to appreciate the introitus. Okay. There can be gapping, and in the hymen there is presence of carunculae multiformis. And how will be the vagina? Vagina will be more roomy. Okay. And also if you take the cervix in a nulliparous woman is conical in shape, and there is a round external os. Okay. Whereas in a parous woman, the cervix is going to become cylindrical, and the external os is just going to be like a transverse slit. Clear? So, these are the some signs of previous pregnancy. Once again, we will revise this. Like signs of previous childbirth include the breast becoming flabby, the nipples are more prominent when because she would have breastfed. Alveolar pigmentation is higher, abdominal wall is lax and loose. We will also be able to see linea alba and stria albicans. The uterine wall is less rigid, broad and ovoid. When she had a cesarean section, you will be able to see the scar of the cesarean section over the abdominal wall, and when